Hello, my name is Dr Vaganov. I'm a consultant anaesthetist here at Maya. Today I'll be answering all your questions related to general anesthesia. Well, firstly, some very minor procedures can be done under sedation. The majority is done under general anesthetic, simply because these procedures are often quite stimulating and can be painful, not very pleasant experience to the patient, and also they might take, on some occasions, a few hours. So general anesthetic is the technique of choice for these procedures. So a common modern way of starting general anesthetic is to give a patient a combination of a strong painkiller and intravenous hypnotic agent, which is basically the drug that sends you off to sleep, induces sleep. Subsequently, we give patient a mixture of an anesthetic gas and oxygen to breathe, so their sleep is maintained throughout the procedure. Normally, patients wake up following anesthetic in the recovery room, which is the room next to theatre, where they're looked after by a specially trained nurse, and indeed an anaesthetist is also present nearby. So normally it takes about 5 to 7 minutes to send patient asleep in theatre or in the anesthetic room. We can keep patients asleep with modern medications for quite a long time, sometimes for a couple of hours. The time it takes to wake up depends on the patient and the surgery they had and the amount of painkillers they have had. And I'd say time varies between 10 minutes to 20 minutes after the surgery. It's a very safe procedure. The incidence of any deaths under general anesthetic is in the range of 1 in 250,000, and statistically it's extremely safe. Firstly, anesthesia is very safe nowadays. Most common side effect is probably nausea. 1 in 3, 1 in 4 people statistically feel nauseous after anesthetic. However, that is reduced with the use of certain anti-sickness medications prophylactically that we nowadays always do. Other side effects people might experience is drowsiness afterwards, which tends to get better and usually related to strong painkillers that the patient receives at the end of the procedure and afterwards. Some people would have dry mouth and sore throat, usually a side effect of certain medications, and irritation from the airway management that we have to do during the procedure. Occasionally people shiver while waking up after anesthetic. We have a special device to keep patients warm during the anesthetic and try and reduce the chances of that happening. We also have warming blankets in recovery to warm the patients up should they develop shivering. No, I've never had this experience. None of the patients of mine had ever reported back to me. It is extremely rare and extremely uncommon with the modern monitoring that we have in theatres, and I always watch my patients very carefully during anesthetic.